Hello everyone, my name is Vaishali and I'm with my team member Rajesh Reddy. Here we are explaining our project is on statistical analysis of health outcomes. So here we first have executive summary of our project. We are going to explain extended statistical examination of health related aspects, analysis of demographic factors, lifetime choices, lifestyle choices, and health outcomes. Here are some key variables that is family history, smoking status, education level, healthcare access, and we are using some different methods like EDA, exploratory data analysis, chi-square test, INNOVA, and from all these aspects, we are finding some keys. Here are some key findings that is family history is closely linked to allergic status or not. Smoking significantly affect disease severity or not. And education level crucial for healthcare access. So we provide evidence for the healthcare practitioners and policymakers as well. Here, the first and foremost step is to select and load the data. We firstly select the data and we loaded the data. Here we have some columns and rows. It is shown in this format. Here we have a proper data of health related. This is the outliers. First we load the data, then after we check the data, if it has any outlier or any null value. See here we are showing that the original data set has a shape of 103622, that is 1036 is the row number and the 22 is the column number. There are total missing value is 630. So we can say that there are the missing data percentage is 2.68%. So this is the first step. After loading the data, we analyze the data, and the second step is handling missing values. So we are like here we get that we having the 2.68% missing value. So the second step we are handling that value. So handling categorical values, previous reaction field 249 missing value with mode save, and the medical condition field 361 missing value with none. So we handle that, handling numerical values as well. After handling missing and numerical value, the total missing value is 0. And after doing the step 2, here we having the step 3, that is handling outliers. So detecting outlier using IQR method, we use IQR method to detect the outliers, if there is any outliers or not. There are some outliers in the like blood pressure row, because there are some values is up to 0, or there are some values is up to above 200, so which is a complete outlier. So we detect that and we solve that. Here you can see in the A section, there we find the outlier before and now. After detecting and removing, we have zero outlier, zero outlier and BMI and the blood pressure as well. So minimum is 0 and maximum is 10. The next step is data preparation and method. After doing the pre-processing, like cleaning the data, the next step is our data preparation. So here we do missing value analysis and handling that outlier identification and validation. As I already mentioned, we did find the missing values. Is there any missing value, and remove that columns and rows as well. Identifying the outliers and validate that categorical variable encoding, continuous outcome and standardization. So after doing data preparations, we are further moving towards statistical method. We use some statistical method like chi-square test of independence. This method we use for categorical variable association, and the other is one-way analysis of variation, that is ANOVA. We use this for the comparing group means. And visual exploratory analysis, we use this method to show the charts and the histograms as well. Now we have some research questions as well. Like see, the first question is there a statistically significant association between a person, family history, and their allergies? Like we have the data of allergies. So if a person is having allergy, is he getting it from his parents or his family? Is it a inherited allergy or not? This is our first question. The second one is, does smoking behavior affect the severity of health problem? Like, if a person is smoking, how much he got getting the disease or allergy by that? The third one is, how much does a person education level affect? Like, how much their education level affect their ability to assess healthcare? So these questions address critical aspect of health equity and statistical methodology in public health research.
Explain about key findings, that is smoking status and disease severity. There are two results. First one is ANOVA result, which is used for significant difference in disease severity between smoking groups. And for heavy smokers, that is significantly higher severity scores. Dose response relationship, that is more smoking, then there are worst outcomes. Now we are talking about public health impact, that is evidence for enhanced smoking cessation programs. So both for there should be focus on disease risk and severity reduction. Smoking as both risk factor and disease progression and accelerator. In the statistical methodology validation, there are assumption checking, independence of data points, adequate sample size, and normal distribution of residuals, that is in ANOVA test, and then expected frequencies, that is in chi-square test. After that, we have to uh, make graphs. We explain all about the statistical data in graphs and representation of age distribution in bar graph, and correlation matrix of health variables in heat map. And then there is also a pie chart, which is the distribution by location, and bar graphs for analysis of allergic versus non-allergic individuals.
Individuals, limitation and the future research, and these are the limitations: potential, unmeasured, like confounder, loss of action, dissemination, and future larger, more diverse dates, and depends on the data sets, because models like neural networks and all the other models for future multi-center, multi-center collaborative studies, and the future research we can do better. And this is the conclusion. Key takeaway. Statistical analysis, significant association between demographic and factors between health and the allergic. And family history, smoking, education levels are the main criteria for this data set. Evidence approach is the best technique to any of these tasks. Healthcare solution can achieve like more outcomes, behavioral risks and factors. Statistical competence translates to public health strategies. And this project related assignment to. Thank you.